Good day, everyone. So today we're speaking with Dr. Mark Sebritz, who's a gynecologist, and he's going to be going through the importance of our 12-week scan. So good day, doctor. So you can tell us why the 12-week ultrasound is so important.
Good afternoon, everyone. The 12-week ultrasound, commonly known as the nuchal translucency or the Down syndrome scan, does provide the gynecologist with a lot of important information. These include telling us how far the pregnancy is or the gestational age of the pregnancy. It tells us whether there is one or two or maybe even three babies present in the pregnancy. It gives us information regarding baby's viability, the heartbeat, whether the heartbeat is normal. It tells us important information regarding genetic syndromes, of which Down syndrome is the most common that we do see, and also can give us important information to help us predict the risk of the patient developing preeclampsia. So it is a combination of different important information that helps us plan better for the pregnancy.
Could you elaborate a little bit more on what Down syndrome actually is?
Okay, so Down syndrome is a genetic condition that affects the pregnancy from the time of conception. Now, if we look at our body cells, all our cells contain little packets of information that we call chromosomes. And normal cells have 46 chromosomes, and that is 23 pairs of similar or matching chromosomes. Now, Down syndrome is a condition where there is an abnormality on the chromosome 21, okay? And the affected person ends up with 3 chromosomes in that 21 range. If you look at the general population, we see about 1 in 600 pregnancies are affected by Down syndrome. And Down syndrome will lead to a disablement in the babies. And it varies across how the severity between different individuals. There will be physical disabilities. So typical features of an individual with Down syndrome would be they will have a relatively smaller and more rounded head. They will have slanted eyes. They may have a flat nose and a very shallow gap by the nose that we call the philtrum. They may have shorter arms and limbs and be a bit stunted in growth. They may be overweight. So there's a varying physical abnormalities, but there's also mental abnormalities that does come with Down syndrome. And the majority of affected individuals will have a lower IQ level, may have behavioral abnormalities as well. And Down syndrome is the most common trisomy that we do see in pregnancies.
So why should we screen for Down syndrome?
Okay, screening for Down syndrome is important. As I said, about 1 in 600 pregnancies will be affected by Down syndrome, and this is across the entire population. We do know that certain pregnancies are more at risk of being affected by Down syndrome. If a pregnancy is affected by Down syndrome, it does mean for the family and for the parents that there will be significant change in their lives. So it allows the parents to make then an informed decision and make an early decision on how they can prepare for the pregnancy. And it allows them to then decide on how they want to continue. The parents may decide that they are not financially or socially ready to have a baby that is going to put more demands financially and socially on the family. And they may decide then to terminate or to end the pregnancy. And it allows us to give an effective and safe way of termination. If the family decides they want to continue with the pregnancy, then it allows us to refer the family for further counseling, where they can then receive support both psychologically and emotionally in order to be prepared for when baby is eventually born, so that they can better manage a baby that is going to be a little bit more demanding than a normal pregnancy.
And what are the risk factors for Down syndrome?
Okay. By large, the biggest risk factor is the mom's age at the time of getting pregnant. We know that the older the mom gets, the higher the chance of abnormalities happening in the egg cell that can then lead to the baby developing Down syndrome. If you look on average, a young lady that is about 20 years old has about a 1 in 1,500 risk of having a baby that is Down syndrome affected, compared to a lady who is 36 years of age. She will probably have about a 1 in 200 chance of having a baby affected by Down syndrome. And then if we move even further down the spectrum, a lady that's 40 years of age at the time she gets pregnant has about a 1 in 50 chance of having a baby that is affected. So age has a very important role to play in the chances of developing Down syndrome. There are other factors. We do see that Down syndrome sometimes has a genetic link as well. So parents may have been affected previously, or maybe carrying a translocation on the gene that they will then transfer to their offspring. So most of the time, those parents may have had a baby that is already affected by Down syndrome. So they therefore at increased risk in the future of also having another child that's affected.
What is the difference between screening and diagnosis?
A screening test is a test that allows us to stratify moms into risk categories. So if we speak about Down syndrome, we classify moms into either low risk or intermediate risk or high risk. So if you think about risk, risk is what are the chances of my baby being affected? And we usually give that as a ratio. Like I said, a young lady that is 20 years old will have a 1 in 1,500 risk, which means for every 20-year-old that is pregnant, only one Down syndrome case will be found in every 1,500 pregnancies, which if you compare to a 40-year-old, for every 50 ladies that are pregnant at 40, you'll find one case of Down syndrome or baby affected by Down syndrome. There are different screening tests available. So the screening is based on the mother's history, on her age, on her family history, and also then on the 12-week scan, which looks at the physical characteristics of the baby. And these physical characteristics include baby's size, or what we call a crown rump length. It includes the presence or absence of the baby's nose bone. It includes the length of the arms or the legs, and also measurement of the tissue swelling behind the neck, which we call the nuchal translucency. I think patients need to remember that this is a screening test, so it only gives us a risk. It doesn't confirm the diagnosis of Down syndrome. In recent years, there's been a new screening test that's become available to our patients, which we refer to as non-invasive perinatal testing, or NIPT. How is NIPT different? NIPT is a blood test that gets done for the mom from after 10 weeks of pregnancy. And what we found is that in mom's blood, there are fragments of placental DNA that circulates in that blood. And from those fragments, we are able to sort of restructure baby's genetics. And when you look at those fragments, there should be a certain percentage or value of certain genes in there. And if there is too many, then the risk of Down syndrome is also very high. And NIPT has been proven to be quite accurate, much more than 99.5% accurate in giving an accurate diagnosis, as not diagnosis, but an accurate assessment as to the risk of Down syndrome. We only do diagnostic tests for moms that then will screen either intermediate or high risk. Now, a diagnostic test is a confirmation test. Um, the diagnostic test does involve having to get baby's actual DNA, and they are a lot more invasive than the screening tests. The diagnostic test involves either the doctor performing a procedure called an amniocentesis. It's a procedure where a long, thin needle is placed through the mom's tummy to draw some of the water around baby, because fragments of baby's DNA will be in that water. And from those fragments, they are able to reconstruct baby's genetics. The other option is to draw some of baby's blood or do a biopsy of the placenta called a chorionic villus biopsy, or CVS. Okay. These tests are invasive, and it does mean passing a needle into the pregnancy sac itself, and does carry a risk of miscarriage. And that risk of miscarriage varies between 1 in 200 to 1 in 400. So it doesn't make sense doing a diagnostic test for a low-risk individual that only has a risk in 1 in 1,500 or less of having a Down syndrome baby, where the risk of miscarriage would be higher. So the diagnostic tests prove the diagnosis of Down syndrome, but they are limited to individuals that will test high risk.
What does a 12-week screening involve?
So the 12-week prenatal screening involves a combination of a 12-week ultrasound and also some blood tests, which then assist in the calculation or the risk stratification for Down syndrome. The scan is performed by either the gynecologist or by a fetal specialist, who will then do a few assessments on baby. The first assessment is baby's length, which we refer to as a crown rump length. So that's the measurement from the head to baby's bottoms. The second assessment is then the thickness behind baby's neck, or the nuchal translucency. What we see is that the thicker the neck, the higher the risk of Down syndrome. We know that babies affected by Down syndrome have increased water retention, increased soft tissue mass. So the neck becomes thicker in Down syndrome babies. They also look then at the baby's heart and the blood flow through the baby's heart. They look at the length on the arms and the legs. We know that affected babies have shorter arms and shorter legs as well. And then they also measure blood flow through the ductus venosus, which is a very specific vessel that supplies blood within the baby's body itself. So those are the features on the scan. And with those features, the doctor may also ask the patient to go for certain hormonal blood tests, which include a free beta-HCG level, includes a PAP-A level, and sometimes an alpha-fetal protein. And those blood levels and the scan information is then placed in an algorithm. And these algorithms have been developed over years of research. And with all that information, it will then give us a risk stratification of whether the specific pregnancy is either low, intermediate, or high risk of Down syndrome.
What is preeclampsia?
Preeclampsia is a very specific pregnancy-related hypertension. So the common symptoms of preeclampsia, number one, includes a raised blood pressure, usually a blood pressure of more than 130/90. It also includes protein in the patient's urine, which we refer to as proteinuria. The patient may develop headaches, nausea and vomiting, and may also complain of excessive swelling of the hands, of the feet, of the face. Sometimes it just leaves the patient just feeling tired and uncomfortable and unwell. If the symptoms do develop, we suggest that the patient sees her doctor as soon as possible, because starting treatment could be life-saving to mom and to baby.
How does the 12-week scan help me prevent preeclampsia?
That's a very important question. Um, Certain fetal specialists, when they perform the 12-week scan, can use the information from the 12-week scan to risk stratify for preeclampsia as well. So they look at the blood flow through certain vessels, they look at mom's blood pressure and mom's history, and will then either tell us whether mom's at high risk or low risk of developing preeclampsia. Um, when we look at preeclampsia itself, it then allows us to institute therapy or precautionary measures to prevent preeclampsia from escalating, or from even sometimes from establishing in the pregnancy. Now, there's been lots of research into preventative methods for preeclampsia, including looking at exercise, looking at vitamins, including vitamin E, vitamin D, and omega acids. But none of that research has been conclusive. The strategies that we do know have an effect in preventing preeclampsia is low-dose aspirin. So if the 12-week scan shows that there are risk factors for preeclampsia, your gynecologist would then probably suggest that you start on low-dose aspirin from about 12 weeks of pregnancy in order to reduce that risk of the preeclampsia developing later. Certain individuals may benefit from calcium supplementation, but that has only been of benefit in individuals that have an pre-existing calcium deficiency. Um, for patients who don't have a calcium deficiency, adding any extra calcium has not been shown to help prevent preeclampsia.
What are the other benefits of the 12-week ultrasound?
So the 12-week scan is usually the first scan where mom, dad, and any brothers and sisters will get to see this new addition to the family. This tiny human being that is busy growing within mom's uterus. They also get to see the heartbeat for the first time. And just the thought that this little heartbeat that is going there at 160, 170 beats per minute is going to be beating for the rest of this little person's life, for the next 50, 60, 70, up to 100 years. It's a good bonding experience for the family that everyone gets to greet and speak to this little person. And sometimes, if we're lucky, this little person gets to wave and kick and do somersaults as everyone else gets to watch this. Um, if we're lucky as well, at the 12-week scan, we may be able to even to see baby's gender. But that depends on baby playing along and opening the legs if we do ask them to do so. Besides that, there's a bit of other medical information we can also gain. At 12 weeks, we're able to see that all the individual parts are there, that there are 2 hands and 2 feet. We're able to see if there is a little bit of fluid collecting in baby's tummy, which we refer to as the stomach bubble. And that tells us that baby has swallowed some of the fluid. And that's important. If baby can swallow food, it tells us that baby's muscle system and baby's nervous system and brain are working enough to allow baby to swallow. Um, if we see that there is fluid in baby's bladder, it tells us that baby's kidneys are working. So we're able to see quite a lot of normal anatomy that reassures mom and the family that this baby is healthy.